Hey y'all, Dr. Ryan Edwards here with Windermere Dental in Cumming, Georgia. Thanks for coming back to our channel. We post videos every Monday bringing you dental news and information to help you have a happier, healthier mouth. If you would like to make sure you don't miss any videos, hit that subscribe button. And if you like what's in this video, hit the like button. We'd appreciate that. You can see I'm back in the office today. We are out of quarantine and we're hoping to begin seeing patients again May 19th. Our biggest stumbling block going forward is going to be getting masks. So we may have a period of time where we can see patients with no problem, and if we run out of masks, we may have a bit of a hiccup in the schedule, so be patient with us, please. Last week, we talked about the causes of sensitivity in your teeth, and as promised, today I'm going to be addressing suggestions that you can use at home to address root sensitivity and tooth sensitivity in general. Now, a quick side note, some of the causes I mentioned last time were cracks in your teeth, cracks in fillings, problems with any existing dental work. If you're having those problems, first and foremost, come see me. We'll address those. Or if you're not a patient of mine, see your regular dentist about getting your fillings replaced or crown work or whatever restorative work that you need. Also, if you are getting sensitivity in your teeth due to tooth grinding or clenching, you should explore getting a mouth guard, and you can try one from the store first. The ones from the store are a little bit too soft, so they can actually stimulate more chewing and grinding over the long run. They're okay to use for a couple weeks as kind of a practice. If you find that you're getting some relief from your problems with an over-the-counter one, that's a good time to talk to me or whoever your dentist is about graduating you to a custom one that's going to be better for long-term use to prevent other problems. Now, I will say, also, if you're having additional sleep issues, like waking up frequently, heavy snoring, if your bed partner witnesses you gasping for air in your sleep, those are indications you probably have some other sleep issues. In addition to the grinding and clenching, you should probably see a sleep physician first before we get into making a mouth guard, or your dentist makes you a mouth guard of some type. All right, good. So those are your general, more severe issues that you can, the more severe tooth sensitivity problems that you can address with your dentist or your physician. If it's just run-of-the-mill root sensitivity like we talked about, or due to tooth abrasion or acid erosion, these are some at-home things you can try, or some things you can do with us to kind of manage your sensitivity in that regard. So the first thing I always tell everybody to try is a sensitive toothpaste, and that usually does the trick. Sensodyne is a popular one. Now, Sensodyne does take up to 2 weeks to help if it's going to. The other thing I always tell patients as well is that Sensodyne does not contain the common foaming ingredient called sodium lauryl sulfate. You might see it abbreviated as SLS. Some people are sensitive to it, so when Sensodyne made their formula, they took out anything that people could potentially be sensitive to and then added the desensitizing ingredients to try to help folks out. Not everybody likes that sensation of not having the foaming, so if you use Sensodyne for a couple weeks and it's effective, but you don't like the foaming, the lack of foaming sensation, then I would try a different one. Another one I also often recommend is Pronamel, and then Colgate for sensitive toothpaste. Colgate toothpaste for sensitive teeth is also fantastic. So try those. Do give them up to 2 weeks before you give up on them, though. They can take that long to work. Now, I know Sensodyne has a new formula that they advertise works in 3 to 4 days. If that does the trick, great. If it's still not working after 3 or 4 days, I'd give it a solid 2 weeks before you give up on that. So try that. Sensitive toothpaste usually does the trick. If it doesn't, then the next thing you can try are these desensitizing strips. They're a lot like the Crest White strips that you can get from the store for bleaching your teeth. They're like little plastic molds that go on your teeth for a few minutes every day, and they actually have a desensitizing ingredient in them. Now, we get these from a dental supply company. If the toothpaste doesn't do the trick for addressing your sensitivity, let us know. This is the next thing we can try. And this works great also if you have sensitivity everywhere. It's not just 1 or 2 spots, but you have sensitivity everywhere. This works great for that. All right, what if this doesn't do the trick? So the next thing we can try is actually applying a varnish to the root surface of your tooth here in the office. We very carefully dry the surface of the root and then use a little brush to apply a varnish to that area, and that seals up that root surface pretty well. The drawback is it only lasts about 6 to 12 months, and then you have to either reapply it or find some other method of managing the sensitivity. Now, usually in that 6 to 12 month period of time, if you're also using a sensitive toothpaste with that varnish that's been applied, that usually is effective enough to get it under control and manage it going forward. But if it's not, then we can always reapply the varnish. Okay, what if all of those things don't work? Then we can take it up one more notch, and worst case scenario, if none of those things work and you're still having significant root sensitivity on your tooth that's not caused by anything else, then we can always actually put a white filling material over that root surface to seal it up for good. And that usually does the trick. That works pretty well, but you're getting a filling done, so it's a little bit more invasive. That's why I usually try the simpler things first, and usually those do work. But those are your best bets to manage root sensitivity and sensitivity in your teeth. Hopefully that information was helpful for you. If it was, please let me know below in the comments. If you think I forgot anything, let me know about that too. Oh, I did forget to tell you something. in that sensitive toothpaste, the key ingredient you want to look for is potassium nitrate. Look on the back, you'll see potassium nitrate on there. That's the active ingredient you want to look for in the toothpaste that will let you know that it's going to work best for you. There are some other sensitive toothpastes that use just stannous fluoride, and that can work okay. The drawback with stannous fluoride is it can stain your teeth. And I don't feel like I have seen patients get as good relief from stannous fluoride as they've gotten with potassium nitrate. So look for that. Almost forgot to tell you about that, I apologize. So there you go. So I think I've covered everything. If you have any other questions, let me know in the comments below. If you have any other suggestions for future videos, let me know in the comments below. We are going to be opening the office this week. I know a lot of other dental offices have already opened or are also opening this week, so I wish everybody the best of luck, and I wish all of our patients to be as safe as possible. Please read our email very carefully. We sent that out just the other day, detailing what to expect when you get to the office. Please read that very carefully. I will be sending out a video actually next week, kind of reviewing the instructions we're going to be asking everyone to follow when they come for their appointments. So everyone be safe, have a great week, we'll see you next time.